And welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mealy, and we're talking about all kinds of different procedures today. We talked about breast augmentation, and now we're talking about gynecomastia reduction.
Yes.
Did I say it right?
That's
Gynecomastia
correct.
reduction. Okay, first up, for those people who don't know, what is gynecomastia?
So gynecomastia, literally it means female breast.
Oh, okay.
But it's on men, which most men don't want breasts.
I
We want
gotcha.
it to be flatter.
Okay.
So the reduction is either removing the glandular tissue or sometimes a combination of glandular and fatty tissue that's on the chest. So it smooths out and looks more like the muscle underneath.
All right, so why do men get gynecomastia? And can you do, just take it out with liposuction, or is it a whole genetic thing?
Probably
Why?
there is a genetic component, but the majority of men have some form of gynecomastia during adolescence.
Really?
In fact, every male is born with it
Yeah.
because of the estrogen from their mother.
Okay.
And if you look at a newborn, they usually have little buds, male or female.
Oh, that's
And then
interesting.
as the estrogen wears off, it goes away. But the same thing during adolescence, we start to develop different hormones. There's some cells that are more sensitive than others.
Right.
So even though the hormone levels may not be different, one man may develop breast tissue and another may not.
And is it just a man looking at himself going, I pretty much need the surgery? Because who needs it really? Is it chafing of the shirt, or is it the look? Is it always, a big problem, or what?
There's a lot of different reasons. I think chafing is one of them.
Yes.
Sometimes the only place that's
Especially if
full
you
is
run.
right under the areola, and it looks like a little scoop of ice
yeah,
cream
yeah.
on the chest, so that's kind of annoying when it rubs.
Yeah.
Other times the whole chest is enlarged and it's just hard to fit in a shirt.
Yeah.
And I'll see people in my Walnut Creek office when it's 100 degrees in the summer, they'll come in wearing two shirts and a sweatshirt just so
Yep.
that it's smooth and looks good. And I know I've done a good job when they can come in with a t-shirt.
That's true.
It makes everyone
No
happy.
chafing.
Yeah.
All right, let's go to before and afters, okay?
Sure.
First picture up, here we go. Wow,
So here's someone,
okay.
it's kind of coned out.
Yes, it
So the
is.
nipple's projecting. It's embarrassing even in clothing. Because
Yes.
it doesn't ever flatten out, it doesn't go away. I had patients come in that wear duct tape just to flatten it
really?
out underneath their shirt. Yeah.
Just over the nipple, or
Yeah, I
something?
didn't choose any before and after pictures with the rectangular
Yeah.
mark
Oh,
from the
right,
adhesive,
right.
but it's not uncommon.
Wow.
And in this case, I've gone all the way around the nipple. We were talking about scars in the
Yeah,
last
yeah, yeah.
segment. In this case, I've gone all the way around the nipple and reduced the areola a little bit to help flatten it.
So you cut around the nipple?
Yeah, so sometimes you can just unstuff it.
Wow.
In this case, I had to unstuff it and flatten it.
I do not see any scars there at all.
Well, the nice thing is the nipple, the areola there is a different color. So if the scar's a little
I
darker,
gotcha.
a little lighter, it tends to hide.
Here's the next picture, and just before you start talking about this, I want to mention for men and women, if you do cut around the nipple, do you get the sensation back? Is it the same?
This is a different operation than for women. So
Oh,
with
okay.
women, when we're doing breast augmentation lifts, we leave the nipple attached. We try to preserve that whole area where the nerve comes in and the blood
Gotcha.
supply. With men, when we're removing this tissue, it's like doing a mastectomy.
Oh, okay.
We are
Wow.
removing the area
Okay.
where that nerve comes through in order to make it flat.
Gotcha.
So it does tend to go numb, but some sensation comes back because the skin around it still has sensation. It tends to grow in there. And usually comes back to about 75%. So no incision
In this
around the
picture?
areola here, just unstuffing, just taking
Why
out tissue.
does the areola look smaller in the after picture on that one?
Because we've removed some of what's
You
behind
removed-
it,
okay.
and the skin has the elasticity to retract.
All right, third picture. Now,
So again, fullness underneath the nipple, pretty much.
Yeah,
The
'cause
picture
it doesn't
before
look
this,
like
I
he has
did both liposuction and reduction.
Okay.
This case, usually you can just get away in these sort of situations with just making the incision from about
Wow.
4 to 8 o'clock underneath the nipple and unstuffing it, just taking out that extra tissue and
that
making
looks
it flat.
amazing.
It's a little harder than it looks because you can't just take all the gland out, it'll leave a dent.
Yeah.
So you have to remove just enough,
Wow.
but not too much.
All right, and another picture?
So this is
Oh,
a side
that's it.
view. Again, fibro, fatty,
Definitely.
glandular tissue, a lot of liposuction helped with this. But in these cases too, sometimes I will do liposuction, I'll be left with sort of a hard lump underneath the nipple.
Really?
I need to make the
So you
incision and
need
get
to
that out.
That is a very good recovery. I mean, there's no scars there at all. And our last picture here.
So same thing here.
Wow.
Not a bad shape to start with, just a little too full.
Little too full, definitely. That
So
would chafe.
We're reducing it and making it look like the rest of the body. And the downtime with this, a lot of times after a week or two, I'm letting people start doing more with their arms.
Mm-hmm.
Again, 6 weeks, everything is allowed. But sometimes exercises like flies, pull downs, lats, where there's a lot of excursion, we're
Yeah.
reaching far away. We want to calm that down at the beginning so we don't get into extra swelling or discomfort.
Now, what about men in plastic surgery? Are you seeing a lot more men coming into your practice? Are you seeing this mostly with the gynecomastia, or are there more procedures that men are doing now? Because, everybody's concerned about their looks.
I think it's become more acceptable for men to have
Yes.
plastic surgery. With the gynecomastia reduction, unlike women, we don't network as well. We don't tend to talk to our buddies about
True.
it. We tend to just wear a baggy shirt with a pattern
talk
and
about
hope no one
sports.
notices. Yeah.
How about those Warriors?
But it's a very common problem.
Yes.
And as I do it, I find my patients send me more patients because then they are a little
Word of mouth.
more likely to talk to their friends about it.
All right. Well, you know, it's becoming more common. Everybody's concerned about what they look like.
It is, and if there's something you can fix, why not?
Why not? Exactly.
As long as it can be done
and you're
safely
here.
and effectively, it's worth pursuing, at least getting the information.
Absolutely. All right. For more information about Dr. Mealy, you can call 925-943-6353 or check him out on the web, drmealy.com or sanfranciscobreast.com. Lots more coming up. All kinds of plastic surgery topics on Body Beautiful. Keep it right here.